closely monitor infection rates as well as hospitalization over the coming days, and we'll review the situation in another week.
From the SABC's Auckland Park studios, welcome to this evening's episode of The Watchdog. My name is Vuyo Mvoko. Another day, another jump in COVID-19 infections, fueling speculation that President Cyril Ramaphosa and his cabinet may have no option but to impose tougher restrictions this December. The NICD's Professor Adrian Purin is on standby to weigh in on the fundamental issues on the back of the numbers just released. With only days to go now before Parliament debates that all-important land issue, Legal Eagle and author of 2 books on the land issue, Advocate Tembeka Ngugaitobi, looks at the sticking points. And on our slot, an academic speaks to different forms of gender-based violence and harassment in the workplace, as Treaty of Nations of the world are being urged to implement a protocol that deals with the scourge. All that and more coming up in tonight's episode of The Watchdog, which starts right now. South Africa now has 11,535 new cases and 44 deaths. Gauteng and the Western Cape say the new variant Omicron is the driving force behind the spike. Professor Adrian Purin is the Executive Director of the National Institute for Communicable Diseases, which released the figures a short while ago. Good evening, Prof. Thank you so much for your time. It's getting scarier by the day. I remember saying this yesterday on the back of the numbers we got compared to the numbers we had the day before. Looks like, every day we're registering around 4,000 new cases.
Absolutely, it's a very dramatic change in the numbers compared to a few weeks ago when I think we were looking at low positivity rates, but now we're certainly seeing that the numbers climb very dramatically. So I think we can describe mostly to what we're seeing is the likelihood that the variant is here. It's extensively being transmitted, but I think there's still much to be known about this particular variant and the implications. I think what is critical is certainly that we're seeing this dramatic rise in cases, but I think we need to look at what we call the so-called lag indicators, and that is looking at hospitalizations and death as well, to determine whether or not there is a dissociation between that, especially if we have a substantial proportion of individuals that have been vaccinated. Does that provide some level of protection? And therefore, we will not see the inevitable, as we have seen in the previous resurgences, of the overwhelming of our hospital systems. I think that's really going to be key over the next few days.
Mm-hmm. I saw, I was reading today reports from journalists who attended a briefing yesterday where, as you have just said, the health authorities were saying it's still too early to say a lot of things, that a lot that is not known, and therefore projections and predictions are difficult to make. But how does one balance that against what I was saying earlier, where Gauteng and Western Cape provincial health authorities were saying it is becoming clear from what their preliminary information that they have that Omicron is the driving force behind the surge in numbers?
Yes, so I think that the fact that Omicron is here, that it's the predominant variant that we've seen, at least in 5 of those particular provinces, I think certainly contributes to that. So I think what is essential really is that those resurgence plans that those particular provinces have should be put into operation. In other words, that they know what their bed capacity is based on the likely modelling that is ongoing with regard to what this trajectory would look like and the possible likelihood of what level of hospitalizations may occur. So it's important to ensure that the bed capacity, the oxygen capacity, the staff that should have received their boosters, all these particular factors are really going to be critical in order for us to be ready to face up to potentially larger numbers of individuals reaching our particular hospitals. But as I said, I think what is critical here is to ensure that we have the necessary information that's coming through our hospital systems to really understand who is reaching our hospitals. Is it vaccinated? Is it unvaccinated? What's the ratio between those individuals, specific age groups and so forth. I think these are the key pieces of data that we really need to see and determine whether or not at least there's some level of protection that the vaccine is certainly providing. It may well be that we will see large numbers of breakthrough if it's thought that this particular virus is really about, or this particular variant is more about immune escape, in which case we will see the larger numbers of cases, but hopefully milder infections and prevention of serious infections.
Why is that particularly important, Prof? And I'm asking for this on the back of a whole variety of reasons. In the previous wave, for example, we were quite a bit unawares, even though there had been predictions that a third wave was already coming. Does it not simply matter, or is not just important for our health authorities to just prepare for a worst case scenario without necessarily, having to consider, to sort of have to get any empirical, evidence? Does it not go without saying, that they should build resilience into the health system in any event, prepare for a worst case scenario, and that's what should matter right now, instead of a wait and see thing which by the time we may get to the worst scenario we could even imagine, or our health system may just not be prepared, or may just not be resilient.
Yes, so I think those are very insightful comments. I think that I think it's in some ways, regardless of the variant that is in circulation, that we do need to be prepared. And I think that's why and that's probably what has been happening, is that those particular provinces have and should have had the plans in place in order to be ready. I think there's a lot of discussion around the resiliency of the health system. There's a recognition that they are essential medical services, and it's really that balancing between understanding of what is really required and integrating the COVID in as part of our broader management, rather than focusing on that specific infection specifically. So I think you're right that there needs to be a focus not just on COVID, but also the broader resiliency of our medical services. I think what is important, though, is that we do have various scenarios, and those scenarios can play an important role as what we can expect to see. And that does inform in many ways the plans, the resurgence plans. But I think it's still important for us to have that empirical data. There was another variant that's still in circulation in South Africa that also has very dramatic changes, but yet that's at low levels. So if we had modeled against that, we would see a very different picture. So I think the modeling exercises in terms of the scenarios, the likely scenarios, I think is still critical. But I think the empirical data, whether it be the epidemiological data based on our hospital, our vaccination data, and linking those, as well as some of the laboratory data, certainly does play a role in informing some of our particular strategies. But you're right, in the main, our approach should still be that this is a variant, we need to manage it. And I think it comes back to all those particular communications that so many of us has been involved in terms of the so-called non-pharmaceutical interventions. Again, I think, has that disappeared? No, I think it should still be in the forefront. We should still be emphasizing the need for the public to be wearing masks, wearing them correctly, the physical and social distancing, the avoidance of large-scale events, especially in unventilated areas. These are still critical interventions that need to go with the need to vaccinate at a large scale.
In fact, I wasn't by any means, undermining the value, of collating empirical data, Prof. But I just wanted us to start there to ensure that those among us who end up in hospitals, do or get at least assured, that they will get the help, the best possible help that they can get, and especially on the back of previous experiences. But coming back to the value and importance of whatever empirical data we're going to, that is being and will continue to be collated over this period. What is its value? Why is it important, to collate this information? Why is it important to know whether the person who ends up in hospital has been vaccinated or not? For us, ordinary people, it is not that, obvious.
Yes, so I think what is important is that when we didn't have the presence of vaccines, people ended up in hospital and they died. They had particular clinical presentations. But with the introduction of vaccines, this has changed what's actually happening at a hospital level in terms of the seriousness of the infections and the outcomes in terms of being hospitalized and dying. So there was this marked disjunction between the rapid rise in cases and when you introduced the vaccines, there was a slower increase in hospitalizations. In fact, systems did not become overwhelmed. This particular variant, what is really important is that, is this variant, will it allow for immune escape? And will it result in immune escape? And the effect of that is that we will still have large numbers of cases, but that those individuals that are vaccinated will be protected. And that's going to be critical for us. So we want to see, hopefully, a flatter curve than what we've seen in previous resurgences, that our system does not become overwhelmed. And therefore, it will be critical for us to say, well, who is ending up critically ill in our hospitals? Is it the vaccinated or the unvaccinated? If our theory is correct, then we would say that the people that are ending up with serious disease are those that are unvaccinated. And again, from a public health policy perspective, and for those who are listening, means that the vaccination plays a critical role in preventing severe infections, and therefore our hospital services will not be overwhelmed. You're quite right. Our systems were overwhelmed for each of those particular waves. We want to change that, make sure that this virus is adapting to us. And that means the vaccine really does play an important role. And that's the importance of these empirical data.
I'm keen to know your view or opinion here, Prof, on over the past few days, health authorities have observed an uptick on a lot more people are now returning going to hospital to take up the vaccine. And I know that for a lot of people, the assumption was that those who didn't go may well be the case, perhaps with the great majority of them, but it was assumed that almost everyone who, didn't go for a jab did so because they were fundamentally opposed to a jab. And I remember having a conversation earlier in the week with a doctor, having read a piece in The Guardian, where it was said that it was actually a whole host of reasons. Other people didn't go because they just felt they didn't have the time. They didn't prioritize that. They were going to the gym and they were feeling all healthy. Some never had COVID before, or another person was a pregnant women who were worried about, we're not fundamentally opposed, but we're worried about what the possible side effects may actually do to the unborn baby. And so there was a litany of all these, isolated perhaps examples, but, which belong to the, whole in the, at the end of the day, when you think about things also, when someone points to you things that you may not have been aware of or alive to.
Absolutely. So you're quite right. There's a spectrum of vaccine hesitancy in South Africa and all over the world. I think there's going to be a core group of individuals who will have a particular philosophical, ideological, or religious basis for that, or to subscribe to particular views around vaccines. But there's going to be a fair proportion of individuals who, by providing them with the necessary information and knowledge and understanding that, for example, these vaccines are safe, they've gone through high stringent regulatory authorities, and they will the side effects will be at least at a minimum very rare serious side effects. So I think it's really being able to educate or allow people to ask the questions and provide them with the necessary knowledge and to encourage them to be vaccinated. It's unfortunate. I don't want to scare people, but I think perhaps the concern is that they've seen this very rapid rise around them, and I think we saw that in the third resurgence, and that too may, I think, give them a spur to say, well, perhaps I should really vaccinate. And I think there's also the ability to act as a community. In other words, if I vaccinate, I will protect not only just myself, but protect others as well. So I think there's that whole range of approaches that we need to adopt to encourage people to get vaccinated.
Are we doing enough of giving them that information that they perhaps need to nudge them to go for the jab? Are we all giving enough information to debunk some of the myths?
I think it's very challenging. I think especially in our world of communications now, with various communication platforms, from WhatsApp to whatever there's where people do get their information from. So I think it's really that ensuring that we communicate, that we are seen as being trusted, or find individuals that can present that information, and because they are the trusted members in their community. So I think there are multiple ways in which we could do it. But I think that our communication platforms are in competition with each other. And how do we ensure that we're getting our message through with regard to the fact that these vaccines are highly effective? We know that in the face of a variant, we will have breakthrough infections. I think we recognize that from the outset, but that we will have some level of protection at least. And I think it's really trying to get those messages through. We should look at the way in which we present our language. I think that's also going to be critical as well. Are we providing it in a format that people can understand, that's respectable, but in order for them to still be able to grasp what it means to have a vaccine, what it means to have a particular vaccine? Given the numbers of people that have entered in hospitals, given the nature of the fact that we have large numbers of people that are obese, diabetic, have cardiac and other diseases that put them at high risk. We've seen the numbers of people that have died as a consequence of this particular pandemic. I mean, it is frightening to see that there are such large numbers of people that have died as a consequence of this virus. And I think it's really critical for us to really get these messages through to people that there is a way, there are ways from the non-pharmaceutical interventions in combination with the vaccine to prevent these infections.
Quick last one, Prof. It's not your place, perhaps, but I'm keen to, find out from you whether, seeing the numbers we are talking about tonight on the back of numbers we saw yesterday and the day before. If this trend continues, does it give the authorities or the people who will have a final say in it, and that's your president and his cabinet, a great deal of a choice, as to what they may have to do next to really help, those of us who can help themselves do the right thing, not only for ourselves, but for our friends, for our relatives, for our neighbors, for everybody else?
That is a very important question. It's not my place to say what the final version of the president's speech will look like. But I think what comes from that speech that we did observe on Sunday was that the approach is different. And again, I think that's because there's been a coalescence of thinking around so-called lockdowns and our approaches to lockdowns. I think that thinking has changed. And so I think it's really trying to look at what particular interventions, rather than just simply saying we'll have a lockdown 3 or lockdown 2, what are the key interventions that will allow, for example, us to really manage this particular epidemic? So that maybe, if that speech is what I understood it to be, as an indicator of what the future steps could be, then I think that will be one of the routes to go. But you're quite right, the prerogative around declaring level 2 or level 3 is the president's prerogative after consultation with all the other experts and communities around him.
Prof, let's leave it there for this evening. Thank you very much for your time and insights. Professor Adrian Puran, who is the Executive Director of the National Institute for Communicable Diseases. About an hour ago or so, they released the latest numbers, and things are not looking well at all. 11,535 new cases and 44 deaths. Now, Health Minister Dr. Joe Phaahla, his department and some of the country's eminent scientists are scheduled to hold a media briefing tomorrow morning, and that's where they'll share some data, trends, and hopefully share some of their thoughts on the direction they may advise the executive to take going forward. The SABC will, of course, as we have been doing throughout, carry that briefing scheduled to start at 8 a.m., I should say, live. The Watchdog continues on the other side of this. Welcome back. This is the Watchdog. Now, in about 6 days, Parliament is scheduled to hold a debate on the amendment of Section 25 of the Constitution. This would provide for the expropriation of land without compensation. We're now joined by Advocate Tembeka Ngugaitobi, who is the author of 2 books on the subject of land. The Land is Ours and Land Matters. We're going to discuss with him what is at stake at next week's debate, I should say, as politicians will, of course, no doubt continue to disagree or agree to disagree on the amendments or on what amendments should be made. What we know is that the bill, in whatever form, or perhaps it may not satisfy everyone, but as it currently stands, it is ready to be considered by the House. As to what transpires afterwards, of course, that's a matter for another day. But to take us through some of the salient features of this bill, but also where the parties actually differ, where there may still be room, if there will be any, for negotiations, is Advocate Tembeka Ngugaitobi. Advocate, good evening. Thanks very much for your time. Now, the last time the parties, were, I can't say at each other's throat, but, where they had some really heated debates around it. In the main, it was between the EFF, and the ANC, because the EFF would not support the amendments pushed by the ANC, which means that there should be compensation. Compensation, but only under certain circumstances. Whereas the EFF was saying, expropriation without compensation. Am I being too simplistic? Put that as a perhaps departure point.
Yes, it's true that at a certain point in time of the debate, firstly, I must greet you. I didn't greet you back, by the way, which is an un-African thing to do. But it's true that when the debate commenced, the position of the EFF was a modest, I can call it modest, as far as the issue of expropriation without compensation. It asked merely that the Constitution should be amended to make provision for expropriation of land without compensation. The situation has now moved along. The EFF's position, as I understand, is that, firstly, the proposed amendments do not go far enough, primarily in two respects. The first one is that the amendment makes it discretionary or optional to expropriate land without compensation. And the wording that is proposed is may, and it doesn't use the term without compensation, it uses nil. The second one is the idea of state custodianship. Now, that's a relatively new concept, but quite a radical one. The EFF now proposes state custodianship over all land, of course, except perhaps in few instances like private houses. The concept of custodianship seems at this stage of the debate to be the dividing line between the ANC and the EFF. The draft amendment contains a version of custodianship, but it doesn't provide that land shall be under the custodianship of the state. It simply imposes an obligation on the state to take reasonable measures towards custodianship. So that's where the debate seems to be in relation to the ANC and the EFF. Of course, one must not forget that there is another perspective on the table, which is pursued by parties like the IFP and like the Democratic Alliance, like the Freedom Front, that are essentially opposed to any form of expropriation of land without compensation, whose position is clear that all land must, if it is to be expropriated, must be subject to market-based compensation. So what we will see in Parliament on the 7th of December will be a contestation of those three conceptions of land under the Constitution.
Now, let's talk numbers then, because if you look at your IFP, your DAs and your FF pluses, those who are opposed, unless there's compensation, it's market-based, and so on the one hand. And you look at, because historically, when this debate started, the view was that if you got the ANC and the EFF, together, then you're almost there. And then it may then take a few others, them or the two of them, to convince others, and voila, you have the 2/3.
Yes, I mean, that's a fascinating line of inquiry. I mean, looking at realpolitik, forgetting about the ideology behind the expropriation of land with or without compensation. So the realpolitik looks like this. If you start off on the assumption that what this amendment does is to change only the Bill of Rights, then you need a 2/3 majority, 67% of support. If you add that it's not just the Bill of Rights, because there is also that school of thought that it's not just the Bill of Rights, but it is also the founding values that are at stake, particularly the rule of law. Because the debate is, if you are going to take away the power of the court to decide whether there should or shouldn't be compensation, then that amounts to an amendment on the principle of legality under the rule of law and therefore access to court. So if the amendment is viewed as affecting the founding values, which include the rule of law, then we are talking about a supermajority, 75%. If, however, it's an ordinary piece of legislation that does not implicate either the Bill of Rights or the founding values, you are talking about a simple majority. In this case, at the very least, you are talking about an amendment to a right that is contained in the Bill of Rights, which is Section 25. And therefore, at a minimum, it will be necessary for any amendment to pass through to be supported by at least 67% of the members present and voting. Now, the ANC has about 57% or maybe 58%, I'm not sure, So on its own, it is unable to carry out any amendment, even though it has proposed it. So it needs the support of the other political parties. Mm-hmm. Presumably, it could get the support of the EFF, but that would require an exchange of compromised positions. Either the EFF will moderate its demand for state custodianship, mm-hmm. or the ANC will give in to the EFF demand of state custodianship. But we have been through this before. The ANC and the EFF have spoken to each other. They have told us publicly what the outcome of those discussions have been. Mm. The fact of the matter is that they have not been able to find each other. Mm. In fact, my recollection is that the EFF did not attend the last two meetings of the subcommittee that is responsible for the amendment, mm-hmm. presumably as a consequence of political disagreements about what they perceive to be a sellout clause in the proposed amendment. Mm. So which leaves then the ANC probably having to ask for the support of parties like the Democratic Alliance. Mm. Of course, your guess is as good as mine whether or not the Democratic Alliance will lend any hand to the ANC. Mm. So it seems quite inevitable that by the 7th of December, we will have no amendments made to Section 25 of the Constitution.
Mm. You see, I mean, this is the thing which then takes us to the whole point of this debate, except, I mean, beyond MPs standing up and ventilating, But I just want to take you back a step. Now, if, for example, or what about the other attendant issues that people had actually raised about the worries they raised about this bill and how it allows for every Tom, Dick and Harry, as someone put it, to basically sneak in little nefarious agendas as people try to, or as either side tries to get, the numbers that they need to push for whatever position that they hold. Is that even a possibility? Because sometimes, the reason I'm asking is because sometimes issues get clouded because everyone throws every issue that they want to throw into the discussion or the debate. What are the chances, or have you seen any evidence of that over the past few months?
No, there is very little likelihood that there will be any sort of, I would say, quote unquote, smuggling of issues onto this amendment. I think that the positions of the political parties are fairly settled on what they think should be the contents of the amendment. So the prospects that between now and the 7th, there will be a radical shift are actually quite low. The real issue, if we are going to come back to what we need for a sustainable, democratic, peaceful, as well as prosperous society, which the Constitution envisages, is that African people are desperate for land. But what they have been receiving instead is political posturing, not the issues that are of concern to them, but a debate that has no bearing on the real needs of ordinary South Africans. The second point about this is that it is possible for the ANC to embark on a wide-scale land reform project using the instruments of the law at its disposal. But it has chosen for 27 years to choose gimmicks over real service delivery. Unfortunately, the debate has also tended to detract ordinary South Africans from the true issue facing us. And these issues are not difficult to discern. We have a problem of gross levels of incompetence and mismanagement of the process. We have a problem of corruption. We have a problem of dysfunctionality of institutions. we have a problem of policy misalignment. This is not me saying these things. I've recorded them now and I've put them in a book. But these are things that have been done by any credible research into why we have a problem of landlessness in South Africa. For the last 4 years, since 2018, the debate has focused on non-issues and has elided the true problems that are facing South Africans and making it impossible for ordinary South Africans to access land. So it seems to me that the posturing ought to be put to bed on the 7th of December, and that there should be a return to the old historic mandate, which is the struggle was always about the return of the land. The Constitution was adopted with that motto, the return of the land. Its opening paragraph or stanza, which is the preamble, talks about the so-called injustices of the past. That's the phrase that is used, injustices of the past. What are these injustices? The greatest injustice ever done was colonial conquest. It was the idea that people from Europe would invade indigenous people's land and push them off the land. That is what the Constitution intended to resolve. It gave the power of expropriation to the state. It gave it the authority not to pay market-related compensation. It gave it the power to pay below market-related compensation. But we are now 27 years down the line. The power exists, it has not been used. So my argument has always been, we have to stop making a non-issue an issue and start focusing on what needs to be done. Hopefully, parliamentarians will look at each other across the parliamentary debate and come to the realization that enough of the political posturing. It is now time to do the things that should have been done 27 years ago.
Oh, it's interesting you say that because, over the past couple of weeks, as political parties were negotiating coalitions or who should support who in the hung municipalities, one of the conditions the EFF put on the table to the ANC was that let's agree on how you're going to, expropriate land, whether you come up with a program or whatever the case was. And the ANC Secretary General's sort of rather, should I say, casual response was that, that should be easy to achieve because it's nonetheless, part of our, conference resolutions. But of course, as we all know, those conversations, talks broke down because the ANC wouldn't deliver on the very things it said were actually part of, or were by and large, part of their conference resolutions. Which then brings me to a question. Do you think that everything you so eloquently put just now, would land on any fertile ground if at a time of need when the ANC desperately, needed to hang on to at least some of the municipalities, just to stay alive, it wouldn't do that, it wouldn't. Do you think sanity will prevail on a day that they will debate and do what they have been doing over the years, where someone gets up, says whatever they want to say, gets to sit down or yells at the other, and at the end of a 2 or a 3 hour period of speeches, it's all over and we're back to square one?
Yes, I fear that you are probably right in your pessimism, and I fear that that is also a pessimism I share. And part of the problem with why we have to be pessimistic at this stage and we have no reasons for optimism is because land is no longer an issue of justice, which is what it should be, but it is an issue of politics. And anything that becomes a political football is always raised for political expedience. And as soon as the need for the expediency disappears. So, for instance, your point about the land issue being used as a negotiating item over the municipal elections. That is to displace the land from its rightful place in our imagination, which is a question of a historical injustice that ought to be attended to, into a matter of party politicking. Of course, the EFF is right in constantly reminding the ANC of its historical mission. And the EFF is a new party. It's only 8 years old, and yet it's been able to at least keep the national consciousness on the ball insofar as the issue of land is concerned. The ANC has been in power for 27 years, and its dithering on land is precisely what has led us to be where we are. I would abandon the debate on the 7th, but it must be held because it is in accordance with the rules. Instead, I would empower the Land Claims Court. I would empower the Ministry for Land Affairs. Sister Didiza is doing an incredible job in extremely difficult circumstances of no resources, no staff, and no talent that she is surrounded with. And those are the things I would focus on. It's not too late. It's not as if these things cannot be done. But I really would think that if we just looked at the basic problems that are inhibiting land reform, and we start pursuing the debate as a question of justice rather than political expediency.
Do you want to call it, advocate? Wednesday's debate?
No, I mean, if I was a betting man, I'd probably lose a lot of money. I've made many political predictions and I've always failed. The only predictions I usually make, and with some success, are football predictions.
Wow. I guess you're not a Kaizer Chiefs fan then. And that's where we're going to leave it for now. Advocate Tembeka Ngwetobi, who of course has authored 2 books on the question of land, talking to us this evening about that debate that's scheduled to take place next Wednesday in Parliament about amendments to sections 25 of the Constitution, as you've just heard from the number crunching, but also from the ideological disposition of the political parties that will be debating in Parliament. It's almost certain that's a foregone conclusion that that particular debate is not going to advance this issue any further, and it is unlikely to arrive at any meaningful or advance this particular debate in any meaningful ways. We're going to take a quick ad break, after which an academic speaks to different forms of gender-based violence and harassment in the workplace. Gender-based violence and harassment in the workplace is what we are talking about in this segment. And to help us decode some of the concepts, but also make us understand the forms and how this phenomena manifests itself in the workplace, we're joined by Professor Phakama Chongwana, who is a social policy professor at Nelson Mandela University. Good evening, Prof. Thanks very much for your time. First, there is, I suppose, a great deal of ignorance, but some of us do at times choose to be deliberately ignorant so that, we don't have to account for, our utterances and our actions. What does one mean? What do people mean when they talk about different forms of gender-based violence and harassment in the workplace?
Yes. Well, if I may, Vuyo, just apply it, for example, to the conditions under COVID-19, which have increased the continuum on harassment even more than before. So there's different kinds of harassment, from sexual harassment, racial harassment, and people in the workplace that are non-gender conforming also have had increased reports on harassment in the workplace. And of course, violence itself can both be physical violence and mental or psychological types of violence. So all these need to be not only addressed, but prevented in the first place.
What shape or form do these, I mean, physical, I guess that's pretty obvious, but mental, emotional, how do those typically manifest themselves?
Well, for example, violations in relation to sexism can often be psychological in the workplace, or mental, even, where your mental integrity is undermined, and we almost have to adhere to do something that does not align with your own mental or intellectual integrity because of sexism, for example. Or microaggressions have a psychological negative impact in the workplace, and these are used as weapons in meetings or in work requirements that are outside of what is stipulated in your job. So those are some of the examples. Yeah.
And why does the perpetrator want to do this? Is it to exert their authority? Is it to frustrate the other person, either make them feel inferior or have an advantage over them, so that they may then succumb and then get to give you what you may want, from them? What often lies behind, the intentions of the perpetrator?
Ooh, that's a very sort of wide ranged question, and has similar responses, because people perpetrate violations against others for different reasons. Intimidation is not uncommon in the workplace. And of course, if somebody, for example, just an example of a scenario where an employer wants sexual favors from somebody junior to them, so that kind of manipulation takes place where your performance is undermined. And as a quote unquote a victim in such a scenario, you then end up conforming just because you don't want to lose your job, and end up compromising yourself.
Does it also happen, Nje, for no apparent reason, just because the person in the more powerful position can do it, just because they can?
Yes, and it's important to remember that such harassment does not only happen one way. Of course, I think CCMA states that 70% in 2020 to 2021, 70% of such reports have been by women or from women. But that means that there's this 30% that is 27 of which is men, and 3% of which is non-gender conforming people. I've lost my trail of thought, Vuyo, regarding your specific question. If you could repeat it, please.
No, what I was asking was whether there is always an intention or an end goal on the part of the perpetrator. Does it not happen sometimes that the person is doing it, Nje, because they can? Otherwise, there's no end goal that they are particularly working towards? They are doing it because they can.
My view is that people who do such just because they can also have an end goal, and that is to feed their egos. Or, harmful forms of masculinity can manifest in such ways, for example. So my view is that there's always, some kind of gain, whether it's to, impress your authority in such a way that it makes you feel good as the perpetrator. So I think there's always a gain.
Now, a couple of years ago, nations of the world signed this treaty at the International Labour Organization, which sort of seeks to deal with these things. The question is how. For people who are rather pessimistic about how these world fora or organizations, including your United Nations for that matter, people who question their ability to actually get nations to really take these things seriously. How hopeful are you that that treaty, I think 2019 it was, will at least begin, to get nations of the world to take this issue seriously?
Yes, well, yes, as you say, it was introduced in 2019, but South Africa, I think, only sent their documents in November this year, in order to start the process of ratification of Convention 190 on violence and harassment. So it can be quite challenging, especially with shifting paradigms of the workplace, as under COVID-19, with ICT becoming a critical tool. But institutions have to adapt, and measures must be taken in relevant areas of law and policy in order to effectively address violence and harassment in the workplace. If I may, for example, our legislation on the codes of good practice, it needs to adapt and be aligned to Convention 190, because Convention 190 is much broader, and it addresses many more nuanced nuanced violations in the workplace. And the Commission of Employment and Equity, which recommends legislative changes to our labor ministry, has to synthesize South Africa's code of managing sexual harassment, for example, and adapt it to be broader as well and align to Convention 190.
Well, Prof, I hope in the next few days we will have time to really talk through some of these issues, because I'm not sure if, countries that, you look at South Africa, you look at the campaigns that civil society, has been leading. Yes, we now have a strategic plan and so on, but I know timelines, not much is happening. Now one wonders if they get a cue, or they take their cue from an LIO about matters that they've been pressed by their own, people to actually do. But we will, of course, get time over the next few days to look into those. For now, though, that's where we're going to leave it. Thanks to our guest, Professor Phakamani Jongwana, who is a social policy professor at Nelson Mandela University. And that's our show for this evening. Do join us again tomorrow evening, same time, 8 p.m. sharp. Good night.